It's been a really, really hard time. I've cried with most of my employees, and I don't really cry all that much, but this has been an extremely emotional time, and we're not really sure where to go from here.
We have an epidemic of vaping and e-cigarette use by Washington's high school students and young adults.
Because you're taking away a right that we think we should have.
We don't really even fully understand all the ingredients that are in these products, and we certainly don't understand the health effects of all the ingredients that are in these products.
It's a hot-button issue that is generating headlines all across the state. A new tax bill, age restriction, and now temporary ban have brought this issue front and center, even several months removed from the 2019 legislative session. For this field report, we step into the consistently evolving story of vapor product taxation and regulation in Washington. During the 2019 legislative session, sweeping legislation was passed that created a taxation on e-cigarette and vapor products in Washington. The bill in question is House Bill 1873. The bill established a wholesale tax on vapor products by taxing accessible containers of liquid or solution over 5 milliliters at 9 cents per milliliter and all other vapor products at 27 cents per milliliter. The tax is to be reported by October the 31st of 2019 and is due to be paid by January 31st of 2020. So where will the money from the vape tax go? 50% of the funds collected from the tax will go to the Andy Hill Cancer Research Endowment Fund with a cap set at $10 million a year. The other 50% will go into the newly created Foundational Public Health Services account. The account may fund foundational health services as well as tobacco, nicotine, and vapor control and prevention, as well as the support of training for public health officials and enforcement from the Liquor and Cannabis Board.
I will open or proceed with the public testimony for House Bill 1873.
Taking a look back at the legislative process for House Bill 1873, we have a hearing from the House Finance Committee on February the 26th, during which there were varied opinions on the impact of the vapor products tax bill.
This is probably one of the worst things that could ever happen to us.
The bottom line to this bill is that if it passes, we will be out of business. This drastic change in taxation structure will significantly impact both our customers and our employees, making vaping products prohibitively expensive.
Consumers are going to go online and they're going to purchase there. Washington State is going to lose a lot of taxes. I'm going to lose my shops. My employees are going to go on unemployment. It's going to be a sad situation, and we don't want that.
We must keep these products out of the hands of kids, but you can do so without harming consumers and penalizing smokers who switch to vapor products.
E-cigarette use is skyrocketing among our youth. Currently, about 20% of U.S. high school students use e-cigarettes, and about 20% use any e-cigarette or tobacco product.
Regular and significant increases in the tax on tobacco products are one of the most effective ways to keep kids from using these products.
After making tremendous progress reducing youth tobacco use over the past several decades, e-cigarettes and Juul in particular are threatening to undermine that progress.
Once the bill moved forward towards the bill signing, the immense opposition was visible even during the signing ceremony.
Let's smile for the cameras.
However, the vapor and e-cigarette situation in Washington became more complicated after the end of the legislative session as Governor Jay Inslee called for an emergency ban on the sale of flavored vape products.
So my executive order will direct the Washington State Department of Health to take several actions. It will ask the State Board of Health to adopt emergency rules to ban all flavored vapor products, including flavored THC products. I expect the board to take up this request and vote on it at their next meeting on October 9th.
His call for a temporary ban was met with opposition.
Let me make it clear here. This is a contentious issue.
Yeah, because you don't believe the facts.
Questions from media outlets only.
This is a
media outlet.
I'm going to expect you to be quiet for a few minutes because I'm going to speak. This is a very contentious issue.
Following the call for the ban from Governor Jay Inslee, a meeting of the State Board of Health was set to decide whether to move forward with the ban on flavored vapor products. The meeting had both supporters of the proposed ban.
When I have 30% of my high school seniors that are vaping, I've got a problem. And I got a reason, somehow they're getting vape products. I don't know how it's happening, but I can tell you what, most of it's flavored, and I got to be honest with you, this is the tough way to go. Probably not the right way, but I don't know what else to do. Thank you for the time.
As well as those who stood in strong opposition to the regulatory ban on flavored vape products.
To introduce a flavor ban, you're just putting it into the hands of the black market where we don't know what's in it. And if it's in the shops that like it's supposed to be, it's already regulated by the FDA. So there's no point in banning flavor. You need to get it out of the purview of the children in the convenience stores.
Motion is passed.
In the end, the board voted to move forward with the ban, which went into effect October the 10th and lasts 120 days until the first week of February of 2020. The impact of House Bill 1873 is still being felt in the Evergreen State. For this field report, we spoke to stakeholders, lawmakers, and state officials about this highly controversial legislation.
We have an epidemic of vaping and e-cigarette use by Washington's high school students and young adults.
46th District Democratic Representative Jerry Paulette sponsored the vape tax bill.
It's a double whammy. You're making it harder to buy the product, which is dirt cheap, and we're putting the revenue into making sure that we educate, prevent, and help people quit.
Paulette believes that by passing this legislation, that lives will be saved by pushing back against teen vape use.
Making sure that today's high school seniors aren't using e-cigarettes and aren't addicted to nicotine, I can guarantee you we will save at least 1,000 lives by making it less likely that they can pick up an e-cigarette or a USB looking alike vaping product and start being addicted to nicotine.
In terms of adverse health effects, Paulette indicated the nicotine dangers of vaping amongst youth.
That little tiny product has as much nicotine as a full pack of cigarettes. And I've sat with high school students who said, well, we're just puffing on it all day, just this little thing, I'm just puffing on something with vapor. And some of them have consumed 2 pods in a day. That's the equivalent of smoking 2 packs of cigarettes in terms of nicotine content in a day. And that's why pediatricians are finding a horrible incidence of nicotine addiction and sickness from people who thought, I'm just puffing on something that's harmless. It's not harmless, and it's very concentrated nicotine.
Also concerned about youth vaping is State Health Officer Kathy Lofi.
Currently at this time, until we know more about this particular investigation, we are recommending that people not use vapor products.
Lofi also addressed vaping as an alternative to smoking.
Right now, I think it's a little bit hard to say exactly, whether using electronic cigarettes is actually healthier than smoking. There was a study that was published in 2018 by the National Academies of Sciences, Engineering, and Medicine that concluded that if people who currently smoke are able to completely switch to using electronic cigarettes, they were likely to be exposed to far fewer toxicants and chemicals, which, is a good thing. However, I think the other thing that people need to think about is while there may be fewer chemicals in electronic cigarettes, some of the chemicals in electronic cigarettes are different than the ones in combustible tobacco, and they're newer substances, and we don't fully understand the health effects of many of them. And we have almost no data that shows in the long term what's going to happen to an individual's health when they're exposed to vapor from electronic cigarettes for years and years.
In the future, Lofi hopes that youth will understand the risks of vaping.
I really hope that the perception of these products among our youth changes so that our youth do see them as being dangerous, do see them as being products that should not be inhaled. In terms of adult use of vapor products, I think there's still a lot more that we need to learn. I think the jury's still out on whether electronic cigarettes are effective cessation devices, and so it's a little bit hard to say moving forward, what those perceptions should be.
Also speaking to TVW about vaping in Washington was Joshua Babba, owner of multiple vape stores, including Galaxy Vapor in Renton. Babba had this to say about both House Bill 1873 and the temporary ban on flavored vape products in Washington.
It feels like it's destroying lives. That seems dramatic to say, but because our closing down stores and our sales dropping in our other two stores where we can only sell essentially the hardware associated with the product, as well as unflavored and nasty tobacco flavors. We've dropped about 80% in sales in just the two stores that we've had to keep open because we couldn't get out of our leases very early, and we still have to pay on those leases.
Babba told TVW why he is against youth vaping.
Of course, we're going to be very, very invested in making sure that minors don't come in, not only just to abide by the law, but because many of us also started using nicotine when we were younger, and we don't want people to have to go through that and suffer from any negative effects that could have in the future. And it's not cool. This is something that adults have used as a tool to quit smoking, and that's what all of our education is focused around in trying to help people.
Babba expressed frustration with the newly formed state regulations related to vapor products.
It seems really disingenuous from a small business standpoint where we have leases, we have employees that we're paying, for our local state government to not listen to the small business owners that are really trying to work with public health and come up with solutions and say, hey, there is public policy that is really working in the UK. How come we can't do something like that? And instead, the lawmakers seem to be wanting to reinvent the wheel, add huge taxes to our product, and now they've banned 99% of what we sell, as you can see from the shelves behind me.
Well, I don't know if you see behind me, but that used to be our shelf, and now we only have about 2 shelves full.
Sage Pringle, manager at South Sound Vape out of Olympia, expressed frustration with the vapor flavor ban.
A lot of emotion. That's just how it's been. It sucks when we can't choose what to do, when the government just kind of takes something away, especially with it considering the research of it being the healthier alternative.
Pringle spoke to TVW about trends related to vapor and e-cigarette popularity.
Vaping's been around for a long while, a lot longer than people think. It only got popular recently, back in 2010. And that's just because of the more effective devices that came out. So back in 2010 is when it really became a big thing.
Finally, Pringle indicated to TVW that he would like to see the temporary ban on vape flavor products overturned.
I hope that people can get their flavors back, because that's a huge stepping stone in smokers transitioning to non-smoking. We educate the people that come in here, how to properly use their devices, what kind of flavor works for them, what flavors go with which device. There's a lot into it. I want to see it go back in that direction, more freedom of the people, essentially.
Thanks for watching, and be sure to join us next time on Field Report.